Hello everyone. I would like to begin by acknowledging that we are in Mi'kmaq, the territory of the Mi'kmaq people. For my reading, we are gathered today in Chibuktuk, colonially referred to as Halifax. Chibuktuk is a Mi'kmaq word meaning the Great Harbor. The Mi'kmaq never surrendered their territory to the British or the French. Rather, the Mi'kmaq and the governor of Nova Scotia signed the Treaty of 1752, a treaty of peace and friendship that guaranteed the Mi'kmaq's rights to fish, hunt, and trade in perpetuity. But the British Crown, and later the Government of Canada, did not honor the Treaty of 1752, instead forcing the Mi'kmaq off their lands. Modern-day colonialism and systemic racism against the Mi'kmaq of Chibuktuk continue to this day. This colonialism is entrenched in infringements of human rights connected to those using drugs and those in encampments. I'd also like to acknowledge the people of African descent that have been in Nova Scotia for over 400 years, and we honor those ancestors of African descent who came to us before on this land. So welcome everyone to the session entitled Ending the Criminalization of Homelessness, a Human Rights Approach to Encampments, Homelessness, and the Crisis of Drug Poisoning. My name is Michelle Biss. I'm with the National Right to Housing Network, and I have the great honor of introducing two fantastic presentations today. So for those who want to make sure that they're in the right room, although I think this is the coolest room, so you should stay in this room. This session today, Canada's rising rate of homelessness is a symptom of deeply rooted systemic issues in the housing sector. Implementing a human rights approach can help shift the onus of responsibility of homelessness from the individual to the systems that exacerbate the problem. In this session, you will learn about the first ever formal review on encampments as a human rights crisis in Canada, an initiative led by the Federal Housing Advocate, and how prohibitionist drug policy interferes with housing justice, especially for those from marginalized communities. Participants will walk away with a better understanding of how a human rights approach to housing will help end the criminalization of homelessness in all communities across Canada. So I have the great pleasure of introducing Bita and Nicole from the Canadian Drug Policy Coalition, who are going to kick us off. So I'll invite you up.
Thank you so much for being here. Thank you for making time. We are very grateful and excited to be here with you today.
We can't hear very well.
Sorry. Is this a little bit better? Okay. Our presentation is entitled Prohibition Must Be Abolished, addressing the dual crises of the housing crisis and the drug poisoning crisis. My name is Bita, and this is my colleague Nicole. So just a little bit of an overview. We'll start with a background and context of these dual crises. We'll go over a case study that looks at the construction of what we're calling the criminal addict, and we'll have an overview of rights-based policy solutions, followed by calls to action. Sure, absolutely. Is this better? Oh, yeah. I think that was better. All right. So thank you once again. We'll start with a little bit of a background. We'll go over the construction of the criminal addict using a case study, and we'll provide some rights-based policy solutions as well as some calls to action. We really appreciate you showing up, and we invite ongoing conversation, dialogue, and connection following this presentation as well, so please feel free to keep in touch. Thank you. So as a background, Canada is a signatory to the International Covenant on Economic, Social, and Cultural Rights, which means that the right to dignity, equality, self-determination, an adequate standard of living, including housing and the improvement of living conditions, and the highest attainable standard of health are all affirmed in that piece of legislation of international law. So this rights-based approach affirms that people are entitled to these rights and that government and service providers must also uphold these fundamental rights. And when we look at drug policy, we want to apply the same rights-based lens. Our main thesis is that drug prohibition prevents Canada from meeting its obligations under that International Covenant on Economic and Social Cultural Rights, as well as domestic law that affirms the right to housing.
All right, so just a bit of an overview here. This is going to be a presentation that has a lot of breadth, but not as much depth as we would like, just given time constraints. So I'm just going to provide kind of a very brief and abridged history of drug prohibition in Canada. For our purposes, prohibition refers to a legal framework that prohibits or makes into a criminal offense activities related to the possession, consumption, distribution, movement, and manufacturing of certain substances. Canada's federal regime of drug prohibition is known as the Controlled Drugs and Substances Act, or the CDSA. And under the CDSA, the drugs that people are prohibited from possessing and so on are referred to as controlled substances. Now, the CDSA is a legal document, but as with all legal documents, it is therefore also a political document. And kind of the dominant assumptions we have around controlled substances is that they are prohibited because they are dangerous. We are here, I think, to suggest today that the inverse is true, that controlled substances are far more dangerous than they need to be because they are prohibited. And we have a clear case study of this already kind of on the books with alcohol. Canada's history with alcohol is fraught because it intersects with our history of settler colonialism. And in 1876, of course, the Indian Act was introduced. And as a fundamentally assimilationist document, it actually contained one of Canada's first and often overlooked drug prohibitions. It was an 1884 amendment to the Indian Act that prohibited Indigenous people from purchasing or consuming alcohol or from entering licensed liquor establishments. And the core rationale behind this was that Indigenous people, who are of course by then being dispossessed of their land and traditional ways of living, would not kind of diligently work the farmland that was being allotted to them through the reservation system if they were permitted to drink. And somewhat paradoxically, the only way for an Indigenous person to possess alcohol after the passage of this amendment was to become a citizen through enfranchisement, thus losing their legal status as a registered Indigenous person. Simultaneously, the Duncan Act in 1864 was also a piece of legislation that provided a framework for provinces and territories, or provinces, I should say, to opt into alcohol prohibition. The only period that saw the entirety of Canada kind of adopt prohibition for alcohol was from 1918 to 1920 as a very temporary wartime measure. 5 provinces repealed prohibition between 1921 and 1925. However, it wasn't until 1985, and that is 19, I'm not stumbling there, that Indigenous-specific liquor offenses were repealed. And the key arguments that ended alcohol prohibition were, one, that too many people were ignoring the law and drinking illegally. Simply put, people liked drinking and wanted to keep doing it. Prohibition contributed to the expansion of organized crime and political corruption. And a lack of regulations on manufacturing alcohol was making it far more dangerous for people who did drink. And finally, legal alcohol production would be a taxable source of government revenue. And this was arguably the most important kind of factor that ended prohibition. And so the case of alcohol has all of the hallmarks of drugs that remain prohibited under the CDSA. And a century later, the federal government started to implement change on that basis, for example, by removing cannabis from one of the scheduled substances in the CDSA in 2018. Yet drugs such as heroin, cocaine, crack cocaine, and methamphetamine remain illegal. And this is largely because the CDSA is still used as a tool of social control for populations who exist at the intersections of racialization and poverty. And because of time, I will not go through kind of the history of all of the other pieces of legislation, but suffice it to say, every kind of criminalization we have seen of particular drugs has been inextricably linked to racialized social control within our domestic borders.
So not only is prohibitionist policy rooted in discrimination and been used as a tool for racial control, it is simply an ineffective policy in reducing drug use and availability. The iron law of prohibition refers to the fact that as enforcement increases, the potency of drugs also increase. It's prohibition itself that has driven the unpredictable and variable toxic supply that we see today. There are no broad mechanisms for quality control in an unregulated market. And so we've gone from heroin to fentanyl, which is 50 times stronger, to increased contamination with substances like carfentanil, which is up to 100 times more potent than fentanyl, as well as other kinds of substances like benzodiazepines and xylazine, which then make the overdose response much more complicated. So it's prohibition itself that's a driver for this increasingly complicated and contaminated drug supply. And so that's reflected in the devastating rates of loss and death that we are seeing across the country. This bar graph is a very impersonal way of describing the magnitude of loss, but it is a visual representation of how the increasingly complex and contaminated drug supply has led to the epidemic of death that we're seeing today. And that last bar for 2023, that only refers to the first 3 months of the year. We're currently on track to either meet or exceed the death rates over the past few years. And again, this is a completely preventable crisis. Represented in drug toxicity deaths are people from all walks of life, all kinds of socioeconomic statuses, all kinds of settings, both rural and urban. However, drug toxicity deaths are impacting unhoused and housing insecure people in particular. In BC, drug toxicity has been the leading cause of death for unhoused and housing insecure people based on data that was conducted in 2022, looking back at the previous 6 years, so about 50 to 80% of all deaths. Data from Toronto this year for the first 6 months also shows that drug toxicity is the leading cause of death for unhoused people. And data from the province of Ontario show that unhoused people account for 1 in 6 of all drug toxicity deaths between 2017 and 2021. So when working to uphold the rights of housing and health, as affirmed in those international covenants we started with, it's essential to address the disproportionate impacts of the toxic supply. That was good before. Sorry. It's important to understand the intersection of drug use and homelessness without being reductive. So clearly, not all unhoused people use drugs, and not all people who use drugs are unhoused. However, there are some associations between housing instability and drug use. Drug use is a survival mechanism. It is a way to survive extremely difficult life circumstances, such as being unhoused or experiencing eviction. And in fact, there's been research conducted by the BCCSU that shows eviction is associated with increased stimulant use. Stimulant use in particular can be a protective way to survive living unsheltered. And at the base of this, I think it's really important to understand that drug use is not a moral failing. It can be adaptive, it can be a way to survive. And people have used drugs for thousands of years for many reasons, including managing physical pain, illness, and for pleasure as well, and will likely continue to do so. Thank you. Now, the criminalization of drugs under the Controlled Drugs and Substances Act then creates a scaffolding for related laws and policies that further discriminate against people who use drugs and create barriers to housing. So, for instance, Safer Communities and Neighborhoods legislation exists in several provinces and territories across the country, and this is a complaint-driven civil mechanism that facilitates surveillance, fines, or evictions on the basis of anywhere from suspected drug use to suspected drug trafficking, as well as other criminalized activities. So for instance, in the Yukon, somebody that's charged under the Safer Communities and Neighborhood Act for suspected trafficking could receive a 5-day eviction notice. So this is how the Controlled Drugs and Substances Act and prohibition then creates the basis for other kinds of discriminatory laws. In addition to these formal legal mechanisms, there are cultural norms that are impacted, and illegal evictions are very common for people who use drugs and has been demonstrated in research as well. There are frequent rental ads that state no drugs. And on top of that, mandatory abstinence policies impact access to social services, to shelter, and to employment as well. And in the context of unsheltered homelessness and living in public space, we've seen a wave in the past few months of policies that seek to criminalize drug use in public space specifically. So we have in BC Bill 34, which has passed the second reading, that's seeking to criminalize drug use in large areas of public space, including parks and building entrances. It enables enforcement officers to displace people and seize their drugs. And recently, we've also seen in Edmonton, Alberta, and Peterborough, Ontario, those police departments have announced zero tolerance policies for drug use in public space. That will also see police coercively displacing people who use drugs, making referrals to health and social services with under threat of possible arrest and seizure of substances. And these laws that and policing practices that target drug use in public space will undoubtedly target unsheltered, unhoused people in particular. Displacement is, it increases the chance of overdose. It impacts the delivery of outreach and emergency overdose response. In the context of an extremely toxic drug market, it's really important to consider the impacts of displacement and the overdose risk. And drug seizure as well increases engagement with the criminal market and can also increase chance of overdose. Coercive referrals with the threat of arrest are also contrary to a rights-based approach to health, which suggests that all services must be consensual and non-coercive.
All right, and I want to highlight that these are not kind of abstract policies. They have very material ramifications. I am BC based. I live in Vancouver. I consider the downtown east side my community. And so just offering kind of a bit of a case study or an example of how these kind of narratives shape policy in a specific community. For a bit of background context, in April of 2016, the BC Provincial Health Officer declared a province-wide public health emergency after documenting a sharp increase in overdose fatalities. In December of that year, a health minister signed a ministerial order making the provincial operation of temporary overdose prevention sites kind of allowable without needing to get an exemption from the CDSA. In January of this year, we did introduce a 3-year kind of drug decriminalization policy. The policy, since its inception, has been widely criticized for not being sufficiently robust. And despite the ministerial orders and the decriminalization pilot, municipalities in BC have continued to interfere with the opening and operation of harm reduction services and have passed bylaws that reintroduce criminal penalties for drug use while excluding drug users, and namely impoverished and homeless drug users, from public space. Again, somewhat paradoxically, it's often the same municipal actors who denounce public drug use and who have more recently been vocal opponents of the decriminalization policy, who then exercise their municipal authority to introduce these bylaws that exacerbate public drug use and what they perceive as social disorder. And this is due to the ongoing conflation of poverty and homelessness with drug use and criminality. This dynamic has been particularly pronounced in Nanaimo over several years, and again, I'm not picking on Nanaimo. The same can be said for several jurisdictions, but I want to kind of hone in on Nanaimo as a bit of a case study. And I'm just going to read you a few quotes that have appeared in media in the last year or so. And as I do so, I'd like you to kind of consider the assumptions that are embedded in them about people who use drugs and the implications of drug use. So from a September 13th article of this year, the City of Nanaimo looking at options for reducing public drug use. We have a city councillor on the record saying, "This topic is top of mind for many BC municipalities. The needs of drug users must be balanced with the needs of the community. It's business owners who are being impacted as well. Members of our tax-paying public are being adversely affected by having to deal with public drug use in public spaces. And quite frankly, I'm hearing a lot of people saying they're not prepared to tolerate it. They want some action." September 23rd article of this year, City of Nanaimo taking a wait-and-see stance on drug use in public spaces. We have another city councillor on record saying, "I was in a meeting with the business community, and they were talking about how some of them are now struggling with PTSD. Their kids are scared to leave their house. Their businesses are suffering." Another councillor said he had a conversation with a city council member in Nanaimo where drug use is restricted from specific parks, and he was told decriminalization's intent to reduce stigma around drug addiction has had the opposite effect because of a general sense of unsafety. Simultaneously, however, in Nanaimo, efforts to support drug users to build community, to access resources, including health and housing services, and to bring visible drug use indoors have been thwarted by the same city councillors. So for a bit more background, the Nanaimo Area Network of Drug Users, or NANDU, opened a safe consumption site in September of 2022. The site was not sanctioned by the city, but did receive an $80,000 grant from the province and was operated legally under the 2016 ministerial order. NANDU quickly grew to approximately 400 members, and membership and leadership faced extreme hostility from residents and from city council immediately, centered on accusations that they were promoting social disorder and crime. Many of these accusations, again, have been based on vague or unproven common sense assumptions about drug use and users. And the safe consumption site was declared a nuisance property in January of 2023. The site ran out of funding and was closed in March of this year. And I just want to quote site coordinator Ann Livingston here, who is a long-term kind of organizer activist, originally Vancouver-based and now shuttles between a number of municipalities. And she says here, "People simply have nowhere to go. A lot of what is a social deterrent to health is networking, and people who use drugs who know a lot of other drug users have a broader social network. There's some data, and there is a lot of data, I will add, that people who are isolated are more likely to die than people who have more social networks." And this has, of course, occurred against the backdrop of an affordability crisis and a housing crisis. And often in Nanaimo and elsewhere, we have seen kind of people who use drugs being framed as existing outside of the boundaries of kind of the so-called deserving poor. There have been debates about implementing affordable housing, and all of the coverage in media around that has highlighted that people who use drugs are kind of excluded from those debates. So there was a hypothetical city-owned housing development that would house 100, and much of the city council debate around that kind of emphasized that people who use drugs were too hard to house and would be excluded. And I'm gonna, just for time, kind of skip ahead here. And I really wish we had more time to talk about this, but while I am emphasizing that the conflation of drug use and criminality is obviously a problem, and hopefully that's not difficult to agree on or at least see, the construction of people who use drugs as mentally ill or diseased or too sick to exert agency is equally problematic. And we see that manifest in a number of kind of compulsory treatment policies. Most notably, recently in Alberta, we have seen party leader Danielle Smith campaign on and advance a province-wide Compassionate Intervention Act. And we're seeing here the merging of criminal and medical approaches to drug use, both of which function as forms of social control and exclusion and drive cycles of poverty and homelessness. So the act would allow a family member, a doctor, a police officer to petition to family court for a treatment order when someone is defined or deemed as being in danger to themselves or others. The treatment order would require a person to engage in treatment for their addiction and, according to party leadership, to save their life and protect the safety of the community. So again, we're seeing here that conflation of, and it kind of raises the question of whose safety are we prioritizing? And she's quoted as saying, Albertans deserve to feel safe in their communities, not fall victim to drug-fueled crime. When we talk about addiction treatment, we are talking about a form of social control that drives poverty and homelessness. And themes with addiction treatment across the country include that there is no federal, nor are there provincial or territorial databases of treatment, what's public, what's private, how their success is being evaluated, and what their outcome measures are. Addiction treatment centers routinely discharge people or evict people who resume use, irrespective of whether they have been admitted voluntarily or not, and whether or not they have paid out-of-pocket costs. So for people who are unhoused at point of intake, treatment comes with no assurance of locating housing post-discharge. Often we are kind of operating under the assumption that someone is going to be admitted to treatment and within 30 days or 90 days or 6 months will kind of walk out the doors magically reformed and their material needs will have been met. That's not the case. For those who are already housed, involuntary intake abruptly eliminates the prospect of generating income, and people risk losing their housing due to an inability to pay their rent or mortgages. We also know that living conditions in many treatment centers are substandard and dangerous. And again, there is no federal or provincial or territorial oversight body for addiction treatment. It's very, very easy to open an addiction treatment center and in turn then to admit people, take their income assistance or disability checks in exchange for housing them temporarily and then evict them unceremoniously, really with no cause. And a lack of regulations for addiction treatment, it's important to emphasize, really parallels a lack of regulation for the drug supply. And ultimately, I do wish we had more time to talk about this, but coerced treatment fuel cycles of eviction, homelessness, institutionalization, and trauma. Beta touched on the fact that drug use can be highly adaptive. All of us consume substances in one way or another, and consuming illegal drugs is a great way to cope with pain. And involuntary treatment or coercive treatment, which I would posit is most treatment when it's your only option for securing a roof, can be deeply traumatic. And I'll pass it off there.
So again, we want to affirm that rights-based policies are grounded in autonomy and self-determination that affirm people's rights to health, dignity, equality, and an adequate standard of living. We'll go over drug policy that will support people in attaining their highest attainable standard of health. We're advocating for full decriminalization of all drug possession for personal use, as well as necessity trafficking, which is the sharing or selling of drugs for subsistence, to support personal drug use costs, or to provide a safe supply. We're also advocating for full decriminalization of drug use in public space for as long as people are accessing drugs from the unregulated supply. A rights-based approach, again, affirms people's right to health, and using drugs in the presence of others ensures overdose response in the context of a very toxic and unregulated supply. All policies must not include coercive health referrals or interventions, no administrative penalties or fines, no confiscation of substances, and no displacement. Ooh, sorry about that. I don't know what happened. We want to remove enforcement officers from engaging with people on the basis of drug use, reduce displacement from public space, and reduce bans and exclusionary policies such as access around access to shelter, social services, employment, and eventually change social norms and conceptions around drug use.
Next, safe supply. Some of you may already be familiar with that term. Safe or safer supply is a term coined by the Canadian Association of People Who Use Drugs, COPUD, who are based here. And basically, it just refers to providing pharmaceutical-grade alternatives to the illegal drug supply. Now, there's a lot of nuance in there. At the onset of the coronavirus pandemic, the federal government did introduce pathways for prescriber-based access to safe supply. Only some provinces and territories have adopted them. And again, being BC-based, we are considered one of the more liberal or permissive provinces when it comes to safe supply. But in reality, there's only about 4,500 people who have any access to a prescription. And prescriptions that are available very rarely actually meet need. Beta touched on the toxicity and unpredictability of the illegal drug supply. And basically, a lot of people are physiologically wired to a number of adulterants. But safe supply predominantly exists in the form of hydromorphone. People who use stimulants really struggle to access it. There are very few kind of routes of consumption available. So for people who inject drugs, smoke drugs, snort drugs, there are variations in how limited safe supply is. There's also huge divides between urban and rural jurisdictions. So people who are in remote and rural areas, including on reserve, may have to travel hours to even meet a prescriber. And if someone is given a mandate of kind of witnessed ingestion, that is simply impossible. And there's been a ton of resistance to removing safe supply from a prescriber-based model. So we have examples of community-controlled safe supply. The Drug User Liberation Front is a group founded by two people on Vancouver's downtown east side who are buying drugs off the dark web in bulk, didn't want to be buying drugs off the dark web, and had applied for a federal exemption to operate legally, which was denied. Nonetheless, they proceeded to kind of operate their compassion club and were providing people on the downtown east side with safe drugs that had been tested with mass spectrometer, sealed, securely labeled, and they had experienced no overdose toxicity events. And then about a week and a half ago were raided by the Vancouver Police Department and are likely facing criminal charges. Simultaneously, a week later, the BC Coroner Service released a report on safe supply that had been the culmination of kind of 9 months of work with a number of stakeholders, and the key recommendation therein was to facilitate community-based safe supply. And safe supply, I think from our perspective, is really something that has to happen en route to the full legalization and regulation of all currently illegal drugs. And prescriber-based models, or models that rely heavily on approaching people as though they are sick, as though they are incapable of articulating or understanding their own needs or exerting bodily autonomy, is not going to get us very far.
Lastly, the provision of supervised consumption sites are vital in the context of a toxic, unregulated supply. So places where people can receive emergency overdose response, as well as additional social supports and services for people that want them, again, non-coercive. They're places of community building and support, and also places of refuge from criminalization. We'll quickly go over some calls to action. So we invite you to join our mailing list to stay updated on the work that we're doing. You're welcome to review our decriminalization policy. It's available on our website, drugpolicy.ca. If you'd like to endorse it, please get in touch. And if you're in a union, you can work with us to develop a motion to uphold the health, safety, human rights of people who use drugs. We also welcome folks to take vocal and active support for health and human rights-based drug policy, decriminalization, safe supply, including non-prescriber-based models, and supervised consumption sites. Education campaigns and position statements in support of those would be very welcome, as well as developing aligned policies in your organizations. You're welcome to get in touch, and thank you so much. I think we can open it up for questions.
So we have, I think, just about 5 minutes or so for some questions. I see a mic back there folks can try using, and I can also repeat back. Sure, right over here.
Hi. Hello. Can you hear me?
I think so. Yeah?
Yeah, my name is Pinsok Champel, PC. I'm from the Toronto with the Home First Society. So thank you too. Two quick questions. The first regarding the decriminalization, what's your view on the Portugal? They decriminalized a couple of years ago. Now I'm reading something different in the news. That's my first question. My second question, this all policy really help people who are already in the problematic substances. What are the steps? Yeah, these are good to support the people who are already in this problem. What about the government policies in terms of the educating the youth? Even like, let's say, if we can save one kid getting into that substance, we did a huge thing. So what's your policy, what's your view on educating in terms of the school level that we may not encounter any more of these in the future? Thank you.
Yeah. Very quickly, Portugal's decriminalization model is well over 20 years old. Again, it was pretty middling to begin with. There have been some improvements over time with certain health and social outcomes. That being said, if you speak to drug users on the ground, I don't think they've ever been satisfied. Portugal introduced kind of diversion methods. So someone who was, kind of caught using drugs, it would be kind of diverted to some sort of health panel evaluation. It's still quite coercive. So I think I personally would like to see us move well beyond the Portugal model. And I'll also flag that Portugal's drug supply does not emulate Canada's. They don't have the same toxicity and volatility. So if we're talking about immediately saving lives, Portugal's model and decrim alone are not adequate.
Thanks. And to touch upon your second question about education for youth, I think we need to make parallels with sexual health education and harm reduction education and realize that the correct information to reduce risk that doesn't create these sort of impose morals or actions upon youth. So for instance, we know that abstinence-only sex education does not work for youth. And I think we have to take a similar approach to substance use, except that some youth will use substances and do all we can to provide them with the right information and the right equipment and support to not do so in isolation and to be supported by harm reduction organizations and safe adults, really.
Okay, I think, let's see if we have one more question. Oh, I see two hands went up. Okay. I'm sorry, I'm tempted to say whoever can get to the mic first, but that's a bad idea. Bad idea, crowded room. Okay, we'll go back here if you want to approach the mic.
Hi. Wondering specifically in the context of emergency housing facilities and drug policies, I guess, in those facilities. They seem to vary. For those that are more of a try a little bit more of a harm reduction approach, but don't allow use on site. How do we balance the rights of those? Because I hear regularly that we should be allowing use on site, but I'm trying to understand how we balance the rights of those who might be in recovery or on a path to recovery with the rights of those that wish to use but would like to have the facility to be able to.
Yeah, good question. I would offer that not offering use on site is not a harm reduction approach. I think there has to be a case-by-case basis, but ultimately, if someone is on a pathway of abstinence, I'm not sure that they're going to have access to drugs regardless, and I think very often what we see is that people kind of oscillate between periods of abstinence and periods of active use. Of course, that's the kind of the dominant trajectory. And so we know that rates of fatal overdose are elevated after someone's been abstinent. Just from a purely physiological perspective, your tolerance is reduced. And with the unpredictability of the drug supply, you might consume what you had been consuming before, or think you are consuming what you were consuming before and not be. And so I think it's really important on site to have spaces that are safe, that can reduce toxicity events or reverse them. And I think, to me, that, like, just given what the data bears out in terms of risk of fatalities after abstinence, like, that to me is the harm reduction approach. Do you have anything you want to add to that?
Just in the absence of any choice to access safer use spaces and shelter, like for instance in a small town with 2 or 3 shelters and they're all abstinence-based, that really leaves people who use drugs with no choice. So I think it's important to consider what options exist as well and whether there are alternatives.
I'll add one thing. Yeah, sorry, just going now. The reality is, even if you're an abstinence-only shelter or emergency housing facility, people are still going to be using. I'm seeing a lot of nods. And so all it will conceal use. And I'll just say, I have lots of lived experience with homelessness, drug use, et cetera. If you are on a pathway of abstinence, you know who's using around you. That includes addiction treatment as well. You know where the drugs are. So I think having an atmosphere that facilitates honesty, and if someone is pursuing abstinence, they actually have supports, whether that be in staff, in their peers, to reach out to say, I am struggling, I'm feeling triggered. That to me is far safer and more preventative than assuming that people are actually going to adhere to abstinence-based policies, because that's not realistic.
Right before we flip to Ian and Jessica, I just want to give you both a second for 1 minute if there's anything else you wanted to add before we close up.
I'll think of it in 5 minutes.
Okay. Well, maybe we'll give you 5 minutes at the end. Okay. All right. Well, with that, I will invite Ian and Jessica up, who are going to be talking about the very first ever human rights review on the issue of encampments, led by the Federal Housing Advocate.
All right. Hi, everyone. So my name is Jessica. My colleague Ian will be presenting today. Thanks for joining us. We will be presenting for the Office of the Federal Housing Advocate, so I'll be doing a quick overview of that. I wanted to start with a quick land acknowledgement, just to acknowledge that we are presenting today in Mi'kma'ki, the ancestral and traditional lands of the Mi'kmaq people. We are doing kind of a short presentation today because we would really like to hear from you guys. And the links are available on our website, so we'll go over the review pretty quickly, but just to give you just enough information so we'll be able to share and have some of your comments and insights afterwards. So before we start, I just want to go over the Office of the Federal Housing Advocate, who we are. So it's actually housed at the Canadian Human Rights Commission, and we help promote and protect the right to housing in Canada very largely quickly. We do have a federal housing advocate now since February of 2022. Her name is Marie-Josée Hull, and she has a role that is independent in government, and she's nonpartisan. She's a nonpartisan watchdog and drives action to address housing needs and homelessness. She is also able to make recommendations to improve housing laws, policies, and programs to the federal minister responsible for housing. So yeah, we could start. So I'll just go over quickly the chronology of the review itself. So the review was launched in February of this year, of 2023. It was, like Michelle mentioned, the first systemic review undertaken by the advocate. So that was under the National Housing Strategy Act. So this is the first review we're actually launched. We're preparing for more, but this is the first one. It was with the goal to examine the human rights issues facing encampment residents in the whole country, in Canada. It is inspired by the human rights principles that underpins the NHSA, so the National Housing Strategy Act, and it was designed to create space for meaningful engagement and to amplify the voices of encampment residents as rights holders. So we started with a period of engagement, which is like the second point on that slide. So the Federal Housing Advocate participated in many events across the country to hear firsthand from encampment residents and local community advocates, also in 6 different cities. So that was a part of some workshop sessions and roundtables where she met with a lot of people there. In addition, so knowing that there is a significant overrepresentation of Indigenous people living in encampments, the advocate was also part of a number of engagement sessions with Indigenous people, but also with their representative organizations. And then in April of this year, we launched an online submission tool to collect submissions from individuals who have lived experience, so on the field. And to do that, knowing that a lot of people would be hard to reach in encampments, of course, we partnered with the Shift and other partner organizations in 9 cities across the country where we collected submissions with their help. I'll speak a little bit more about that small piece on the next slide, just to give you an overview of what we collected and who we spoke with. The advocate also engaged with duty bearers and government officials at all levels of government to collect information. So, and it was, for example, for municipalities, she reached out to them through the Federal Canadian Municipality, through the Federation of Canadian Municipalities, and through their Big City Mayors Caucus. She also engaged with the Association of Municipalities of Ontario. The advocate also engaged with provincial human rights commissions and federal officials as well. She also contacted mayors and city councilors to share her concerns, and that idea was for cities to become aware of their human rights obligations, to create like a paper trail. So there were cases that we've heard in the news where she was able to engage with those mayors, send letters of concerns, and to make sure that they were exactly aware of their obligations to the municipality residents. Some of those letters are actually available on our website. We will share some links on our last slide, but if you're interested in knowing more about what we're doing in the work of the office, you could go to the Canadian Human Rights Commission website, and under housing, a lot of our works and information are available there. So I'm going to, in October, just recently, so the interim report was released. That report was shared and now is published on our website as well. So that report is not meant to be perfect. We wanted to showcase what we've heard through this whole engagement session, so either through submissions, but also through sessions of engagement that the advocate undertook. And so it was intended to provide a foundation for deeper reflection and to identify human rights-based solution. And it's really based on what we've heard. With that report, now we are in several consultant sessions and meeting with local partners. The advocate also met with CASHRA, which is the Canadian Association of Statutory Human Rights Agencies. She met with the National Association of Friendship Centers as well, some national networks and advocates, and trying to discuss the solutions that are put forward in that report. The goal of those discussions will be to present a report We hope to publish it in the end of January of this year, but that second report will be like the final report, and it's going to focus on recommendations. Not as large and lengthy as the first one, so that we will in some way summarize what we heard, but the goal is to put forward recommendations in that second report. Recommendations will be pushed to the Minister of Housing, but we will have several recommendations for either municipalities, territories, provinces, and the federal government. So those will be divided by level of government. So that's the goal that we're trying to reach with those consultations and also with the conference that we're doing today. So having your input and things that you would like to see in recommendations and things that you might not want to see and things like that. So this is your chance to share it with us. Yeah, I still have the other slide to speak a bit. You could hit, yeah. I'm speaking very quickly about the submissions, what we've received, because this is the part I work the most on. So we've received 366 submissions in total, and of these, 313 were from individuals with lived experience of encampments. We also got 53 submissions from organizations, and that includes, yes, people working with people with lived experience, but also frontline workers and municipalities that participated in the review. So it was very complimentary. It was great to hear from people directly on the ground. So the tool that we had online was actually 3 open-ended questions. So people were able to provide feedback however they wanted to. We got written testimonies, we got videos, we got recordings, and for that, the frontline workers or the partner organizations that helped us on the ground were really useful. So we got very interesting feedback. So as you can see, we got a lot of submissions from the BC because our partner in Victoria was extremely active and helpful. So they collected, over 100 submissions for us. But we also got interesting and really great submissions from Crab Park residents that were actually videotaped, and so those were 20 minutes each and were really deep testimonies. So it was great for us to be able to hear stories. So those different methodology of collecting submissions were great for us. So it gave us a complete perspective of what we heard, like what's actually happening on the grounds. And then Ontario, we got a lot from Ottawa and from Kingston, and then in Quebec, Gatineau and Montreal were the top cities with the help of our partner Caroline Leblanc, who contributed to this review as well. Yeah, I'll leave it at that. And yeah, Ian, if you want to take the lead. Thank you.
Thank you. So the tag now, I'm up. So hi everyone, I'm really happy to be here with you. I'll just quickly go through some of the findings and some of the areas of the potential solutions that the advocate has identified. And as Jessica was saying, really our goal over the next couple of months is to turn those potential solutions into concrete recommendations to different orders of government. So we're hoping we can hear from you a little bit this morning about that, but also invite you to provide feedback afterwards. In terms of the advocate's preliminary findings, I think one of the key goals was really of this review is really around changing the narrative. And so the interim report really emphasizes that the emergence of homeless encampments across this country is a symptom of systematic failures and not the result of individual responsibility. We were hearing from people who are actually struggling to find shelter, and they're doing what they can. They're doing the best they can, and it's really the system that's letting them down. So the recommendations that we hope to submit at the end of January will be to address those systemic issues. The advocate also heard, and this will come as no surprise to all of you, that the fundamental right of encampment residents to live with dignity is at stake in Canada. People are being forced to engage in increasingly difficult struggles just to survive. We heard about issues connected to prohibition and criminalization. And we also heard that these kinds of practices and policies are putting people at greater risk. Unfortunately, the reality that we're seeing in encampments and people who are unhoused is in very stark contrast to what the promise was of the National Housing Strategy Act, which legislated the right to adequate housing as a fundamental human right in Canada. Governments at all levels are not doing enough to fulfill their human rights obligations when it comes to encampments. There are many examples of this, but the most stark example is the disproportionate number of First Nations, Inuit, and Métis peoples who are experiencing homelessness and living in encampments. Many of our systems are failing, the housing system, of course, but also the public health system. The advocate heard that governments are getting it backwards. This leads to them responding to encampment residents first and foremost as a threat to order and public safety rather than an issue of rights and dignity. One submission put it this way: there is no empathy from government, thus no empathy from the public. Another submission highlighted that security approaches just don't work. They don't stop people from setting up encampments. They traumatize already vulnerable and marginalized people and increase their vulnerability to becoming chronically homeless. And they force people even into more precarious places. So until governments are able to offer choice of adequate long-term housing solutions, municipalities, provinces, territories, and the federal government need to be doing everything in their power to ensure that the basic needs of encampment residents are met and their human rights are protected. And while there's much to be concerned about, the interim report also does highlight a few promising practices. The advocate heard from frontline advocates and community organizations about the work they're doing to provide needed supports. But she also heard that these organizations, and I'm sure you can testify to this, you in this room, these organizations and workers are overstretched and workers are at the risk of burnout. So the system is stretched to its limits. We heard that some municipalities and municipal service providers and community organizations are taking new, more human-centered approaches to encampments that reflect a positive recognition of their human rights obligations. And so we highlighted some of these. We recognize in the report that none of these examples are perfect, but we wanted to try and use them as inspiration to municipalities and other orders of government that there is a way to do better, and that if they use human rights principles as a guide, they can help address this issue. So maybe the next slide, just talking about the potential solutions. So first and foremost, the advocate recognized that it's going to take all orders of government. There's not a magic bullet for the federal government or provinces and territories or municipalities. There needs to be more collaboration. They have to stop passing the buck and pointing to each other. There are tools available. The advocates' work has been informed by the National Protocol on Homeless Encampments that was developed by the former special rapporteur and the organization, The Shift, which we partnered with. We're happy to hear this morning that The Shift is also developing new municipal guidance as a tool for cities to how to actually implement the protocol. Just want to mention that LaTanya Ludford is in the room, and if anyone wants to hear more about the municipal guidance, please go see her afterwards. She knew I was going to do that, so I'm not. While all governments need to be involved, the advocate is calling for increased federal leadership to ensure that the response to encampments is human rights based. We've seen the federal government starting to pose some conditions around the Housing Accelerator Fund. We'd like to see similar conditions around human rights be available for any new funding around encampments. Encampments are clearly now a national phenomenon. They're happening in big, small municipalities. So we need a national response. And the nature of homelessness has changed, so the nature of our responses need to change. So in the report, we have a series of potential solutions, and the work over the next couple months will be developing those into recommendations. But again, want to emphasize, as Jessica was sharing, that these are the solutions that were identified by the people who are living in encampments or who had lived experience or their advocates. So as a starting point for implementing the solutions, first and foremost, all levels of government must explicitly recognize the human rights and dignity of people living in encampments and act to protect those rights. Sweeps, clearances, forced evictions must end. We know they don't work. We need to end the criminalization and the prohibition policies that put people at greater risk. We need more accountability mechanisms. The Federal Housing Advocate is one person in Ottawa with a small team, but municipalities, provinces, and territories need to recognize the right to housing officially. We're seeing example in Toronto of the Deputy Ombudsman for Housing. Other ombudsman offices in other communities have addressed housing. We need those kinds of mechanisms everywhere. We need training for officials and education for the public to counter the discrimination and stigma faced by people living on the streets. And as you all know, we need adequate and predictable funding for municipalities, but also frontline service organizations. A human rights-based approach also means meaningful participation and engagement. Government and service providers must engage with encampment residents in a meaningful and ongoing way to find and implement long-term solutions. We need to put lived expertise at the center of the work we do as we go forward. Governments must also recognize the distinct rights of Métis, Inuit, and First Nations. Adequate and sustained funding should be provided to Indigenous peoples and their representative organizations to develop and deliver housing solutions in Indigenous communities and in urban centers. I think people highlighted, again, when we were talking with Indigenous representatives and Indigenous organizations, the failure to implement existing recommendations. So we need to start by following up on what's in the Truth and Reconciliation Commission report, as well as a national inquiry into missing murdered Indigenous women and girls. And we need to ensure that we respect the principles of the UN Declaration on the Rights of Indigenous Peoples, and that solutions are for Indigenous people and by Indigenous people. So while we wait for those longer-term right to housing solutions, encampment residents must have access to water, sanitation, and other basic needs. We need to put in measures to uphold their highest attainable standard of mental and physical health. This includes harm reduction policies, working on encampment safety and security. One of the issues we heard a lot about is access and the conditions in shelters. So work needs to be done in that area as well. And again, talking about systemic issues, I think the Advocates report will connect what's happening in terms of homelessness with the need for adequate housing across the country. So making the link to the lack of housing available to put people who are experiencing homelessness, and particularly non-market solutions, social housing. And finally, there's a need for more research and better data collection. And of course, the work will not end when the advocate submits a report. So monitoring and evaluation and documenting those promising practices. So we're going to continue our engagement. We do have some sessions planned with our partners at the table. So with the Coalition on Drug Policy, the Canadian Drug Policy Coalition, I always get that acronym wrong, National Right to Housing Network, the National Association of Friendship Centers. So the final report will be submitted to the Minister of Housing, Infrastructure and Communities. Under the legislation, the Minister is required to respond in writing. She did have a chance to share her interim report and had some initial discussions. We sense that there is some openness. We've heard some openness from big city mayors, but clearly there's lots more work to be done. So I guess in terms of the work, I guess from the Advocate's Office, we're working on this review, but again, the ultimate goal is not a report and recommendations. The ultimate goal is change. So we're very interested in connecting with you who share an interest in this issue, because you're in this session, around the advocacy that will need to happen, and look forward to working with you in that process. I'm just looking for my questions. Maybe I'll change the slide. So we're happy to take questions about the review, but really we're also interested in hearing from people who are working on the ground, working with encampment residents, as what you would like to see in the report. Some questions we thought we would throw out to you, and just to get things going. So we heard a lot about the need for, about ideas around designated sites for encampments. So, but we also know there are risks associated. So what are your perspectives on that, and what should be done to ensure that if there are designated sites, they respect human rights principles? Want to hear more about your needs in terms of work you're doing with the unhoused and with people in encampments, and what maybe we can include in our recommendations in that area. Suggestions around how we can do more to change the narrative, any examples we can learn from, and any other good practices you might think are worth emulating. Now, we won't have time to cover all of that this morning, so our emails are on the next slide, and if you would like to, they're not there? We will. No, they are there? Okay. But we'd be happy if any input sort of in the next week would be very welcome. So let's stop there and open up the conversation.
Okay, I see a few hands, and we do have a good 15 minutes for questions. So why don't I suggest, I see some hands happening. Okay, how about we start over here? If you'd like to go to the mic, and why don't I suggest, because we do have a good 15 minutes, and because I know Ian and Jessica are really interested in the answers to some of these questions that some of you may hold, I'm going to encourage folks to maybe start a bit of a lineup behind that microphone. And if you would rather sit in your seat and you want to try to catch my attention, do that, and we will figure out a way. But right now, why don't you go over to the mic?
I think my voice is going to be loud enough.
You know what? It's also being recorded for the live stream. It was a good try.
I normally have a very loud voice. So. I was just wondering if you could unpack. You stated that increased federal leadership is needed, and you gave the example of the Housing Accelerator Fund. You stated that human rights conditions could be added. Could you maybe unpack that a little bit? What human rights conditions could be added, and how could you see that playing out?
So these are things recommendations we're trying to develop, but I think conditions around meaningful engagement in terms of how municipalities are going to decide to allocate the funds. We're hoping there will be new funding available through Reaching Home to work on the issue of encampment, so meaningful engagement. I think another issue around developing rights-based policies to govern their responses to encampments, which would hopefully include sort of clearer guidelines and prohibitions on forced evictions.
Thank you.
Hi, folks. Thanks so much for the work that you're doing. I really appreciate it from a community perspective. And I'm just wondering, in regards to the report, is there any acknowledgement on rural encampments and how they show up differently? In communities with less than 3,000, our encampments that we have between 10 to 15 people who the community know by name. And so the impact on that and their ability to find housing or access employment in the rural setting. Working in rural areas, it would be amazing if there's a report to point to on the different lived experience that is.
I think that's an area we can develop further. We have had some engagement in some northern communities that are smaller, and we know that encampments are a phenomena across the country in big, small, rural areas. So happy to get suggestions on how we can develop that and what you would like to see in terms of those recommendations.
Yeah, thank you. We'll reach
So
out.
come up after the session. We can exchange emails.
My question kind of stems off of that question as well, but it's more provincial. I'm just wondering why, so I'm from Summerside, Prince Edward Island, and there was no Atlantic provinces represented in that report. At least there was no events for the advocate to go to. And I'm just wondering why Atlantic Canada wasn't part of that.
It is one of the challenges in terms of the advocate's ability to travel and cover the whole country. Through the local partnerships, we did work with local partners in Moncton and Halifax. So through the submissions, we made an effort to try and fill that void by working through those local partnerships.
Yeah, it's tough too, because if you look at the number of submissions, there was 146 from BC and 1 from PEI, but that percentage is probably the exact same based on the population. PEI is what, 160,000? So that's probably one city in BC. So it's hard for places, especially like PEI, to be represented in things like this with such small numbers. But like you said, every single one of our homelessness people in the population is known by name. So it's really tough for anything to happen, especially when PEI is too far to travel to for people to get an advocate for, and it's really frustrating. So I would advocate for more advocates in Atlantic Canada, specifically the smallest province.
Hi, Ian and Jessica. Great presentation. I just have 2 questions. I noticed that you focused a lot on the municipalities, and I wanted to know, have you guys approached the provinces or territories, considering that housing is under the jurisdictions of the provinces? And then my second question is, how are you defining, I noticed there was a lot about homelessness among the indigenous population, and I just want to know, are we applying a Eurocentric definition of homelessness, and if so, how do we expect to address the problems of homelessness amongst the indigenous community?
So on the first question, which is the easier question, and we've tried to engage with provinces and territories through some of the forums that exist on housing and homelessness, and to be honest, there hasn't been a lot of uptake. I think it's going to be one of the challenges probably after the report in terms of where the advocacy and the engagement will happen. In the absence of provincial territorial government engagement, we've tried to engage the provincial and territorial human rights agencies, so the Cashra conference. On the issue around Indigenous perspectives, again, what we have been doing is meeting with Indigenous organizations to try and hear from them about what solutions they want to see. One of the partnerships that I think will inform that is through the National Association of Friendship Centers, which is leading its own engagement process, which is going to feed into our final recommendations. We've also been working with the AFN, which is developing a homelessness action plan and trying to see how some of our recommendations can align with what they're coming up with as well. Similar meeting with Métis and Inuit organizations. But
Thank you.
Juste un point. Si tu as des questions en français, Jessica et Ian parlent français, so cette session est dispensable en français.
Hi. Quick question. What else I'd like to see in the recommendation that getting into the encampment took a lot of years, and supporting encampment is just about it. The ultimate goal is to getting into the house, supportive housing, whatever. My concern is based on my work that I'm seeing, there's so many effort to put in helping one individual get into a house, but the issue is the maintaining that house, preventing the eviction. These kind of policy I'd like to see in a recommendation in order to the whole holistic wraparound in order to sustain that, because I've seen back and forth many times. Thank you.
no, I think that's something we were hearing about as well. I think it's one of the big challenges, but again, it's around looking at the factors that can set people up to be successful once they're in new homes. And I think one of the things we're hearing too is the importance of choice, like again, similar to what we heard in the first presentation, to avoid coercive approaches. So it's a big challenge.
Hi there. I wanted to address the second part of the bulletin for your discussion, putting it towards us, switch it up a bit here. I think that people with lived experiences who are in the encampments need to be heavily involved when it comes to the entire process of where, when, how it's going to be implemented, and follow up afterwards about how things are working. I think that'll be the best way to make sure that it's successful.
We do have another 13 minutes. Oh, there we go.
Hi. I could speak a little bit to the final question there, good practices that might be worth emulating. In where I work, we have encampment teams that go out. Not only do we develop partnerships with the social service supports that are in the community, but we also develop it with some of the more non-typical supports. So we develop strong relationships with our fire services that go into the encampments, educate people on how to develop safe fires, distribute mini fire extinguishers, distribute smoke detectors and smoke alarms for people in encampments. We also develop relationships with our enforcement partners, our police, not for purposes of what historically has been the relationship between people with encampments and people and police, but police in some areas are trying to pivot, trying to stop the revolving door of people in and out of incarceration. So if you find those few good police officers that are willing to work with people that are homeless, hold on to those relationships and build them, because they become an asset later on. So I would recommend to try to do something a little bit different if you find those few good areas in the police that can help people who are homeless.
Thanks. I'm just curious, where are you from?
York region.
York region, okay.
Sure, you pick it up.
Hi, everybody. My name is Eric LaRose. I'm in charge of the community policing unit in Moncton, New Brunswick. And after hearing you, so I don't really have a question, but I just want to tell you that 3 years ago, the Moncton City, or the RCMP up there, created a community policing unit. We have 6 uniformed police officers, and all the homeless or the most vulnerables in Moncton know them all. We train them to make sure that they're compassionate, and I think we are successful with this program. Yes, sometimes there's enforcement to be done, but it's not a surprise to them. We have a good conversation with them, and I just want to share that with you.
Yay.
And I think that, thank you for both of those comments, because I think it is really important as we do advocacy that we are able to point to good practices. I think there are other police or fire services or municipalities that are looking for examples. So documenting those, sharing those, I think can inspire some communities to do better. But you also need the carrot and then the stick. And some
Hi, my name is Laura. I'm from Waterloo Region. So we, back in January 2023, had the first case that was taken to court against the encampments in Waterloo Region. The region took the encampments to court, and the verdict was that the folks that were staying in the encampments were not in violation of being there, or violation of their rights for being there. So I'm just wondering kind of about the best, good practices. This was supposed to be foundational in so far that we couldn't then ask other local encampments to be removed. That didn't happen. There were a number of encampments throughout Waterloo Region that were broken up since this since this verdict. So I'm curious about sanctioning encampments, and if that is a good practice moving forward, what that might look like, and if there's other things such as sanctioning, I don't know. We also have an outdoor shelter, which is tiny homes, and that's sanctioned land. But yeah, I'm just curious about your thoughts on that.
So just first on the court decisions, I think that's one of the things we've been looking at as well. And I think it's very disappointing that some of these decisions are not having a broader and more positive impact. I think with the nature of the cases and often injunctions, it doesn't necessarily mean that the next encampment you have to go to court as well. You can't just rely on the previous decision. So one of the things we're looking at is also in terms of what kinds of legal strategies are available. I know there are some practitioners which are thinking about eventually some kind of charter challenge, what would be the right case to try and actually make the right to housing that's now in the National Housing Strategy Act actually a justiciable right. In terms of sanctioning, I think that's actually, again, one of the things we're looking forward to hearing more about on the next sort of the positive and negative experiences. What we've heard so far is to be very careful that these don't become, again, sanctioned encampments places of control. They don't recreate some of the barriers that people are experiencing in shelters, and be wary of the tendency, and maybe in a discussion we had with CDPC just about that it is the natural instinct of governments when they sanction something is then to impose their control. So how to have sanction sites where services can be provided, where people have some security, they don't have to pack up every night, but not where they're sort of incarcerated is a challenge. So we're trying to find that balance, explore that balance.
Hi, so my name is Rebecca Weitzman. I'm currently working with Halifax Regional Municipality, and I'm working in the community with encampments. So I just wanted to speak on what Halifax did in terms of creating this designated sites. So we did go around to everybody who were on the streets, and we asked them where they would feel comfortable going, what services were important to them for the designated sites to be near, where they would feel safe, and we just wanted to make sure that they had their say in that, and it wasn't just the government deciding where they were going to stay, because like you said, then it's just us controlling them. So they gave us a lot of suggestions, and we did designate those sites. So now they can stay at those sites. They get water delivery, they get street outreach, they get like nurse outreach, and they are able to leave, like they don't have to leave. So if the police can't ask them to leave, compliance can ask them to leave, and so that's a way that they can feel safe there. And the only negatives and risks that I would say is it has sort of brought like drug trafficking to those areas, because I think they're seeing a group of vulnerable people, and they're kind of whatever the word is, flocking to them. So yeah, that's been something that we're sort of struggling with. That's about it. Thanks.
Thank you.
Good morning. I'm Sheila Woodhouse. I'm from Montreal, and we have residences right downtown Montreal. There was a big encampment that was closed. There was a ruling. The encampment was an eviction. It was an eviction under the underpass. I mean, one of the main underpasses, which is obviously completely inhumane. But my question today is, there is a group of people that are not interested in being housed. How are they being addressed?
Well, I think that comes back to the last question in terms of coercion, in terms of like a human rights-based approach is not forcing people into housing. I think, again, what we've seen with the pandemic is just the closing of public washrooms, a lack of public space that used to exist. The hostile architecture or park benches are no longer places to hang out. So I think we do need to acknowledge that while homelessness and the unhoused has gotten a lot worse, it has existed, and we're not going to get rid of all homelessness. We do still have to make sure that those people, whatever they choose, are treated with dignity and have access to their basic needs.
And I think also we have to address a very aggressive architecture that's happening. We see it outside our hospitals. We see it in the parks where they actually have, in the bus stations where you actually have barriers so somebody can't lie down. And we're seeing this more and more and more. And the fact that the encampment, it was even though it was closed, it was under the overpass. So this, I think, really has to change. We have to start somewhere with the architecture. Thank you.
Thank you.